So what I really want to do today is offer some key actionable strategic ways where you can magnetize the talent that you want as a business owner. With the trend that we're seeing with the Great Resignation, we've got 4.5 million Americans who are leaving the corporate workforce monthly, every single month. So where are all of these people going in droves, and what's driving them away, and how can you take advantage of that traffic and drive it closer to you? So that's some of the things that I'm going to talk about today, Linda.
So tell us a little bit about what your experience is working with business owners, business founders, business entrepreneurs. What are the biggest challenges that they're facing right now in attracting and retaining client, and also providing the kinds of well care, health care, or perks and benefits that are really uniquely tailored to their employee base?
Yes, so I'd like to address this question, Linda, with a scenario that I come across all the time. And that's the small business owner who's growing rapidly, right? And they are excited about that growth. And this might sound familiar to some of you in the audience, but I've got someone that I work with recently, and her name is Cassie. She owns a creative agency in the West Coast, and they are growing rapidly. And to keep up with this rapid growth, they want to attract the top talent, the best people to help them kind of on this rocket ship up. So Cassie has got her eyes on this talent, and she knows that this person will help me take my business to the next level. But this talent named Meg lives on the other side of the country, and she's not willing to give up that lifestyle of remote work. She's finally found a work-life balance. She's got good work from her corporate role, and she's getting good health insurance benefits. So that decision to leave that comfort, that safety, that security of a corporate benefits plan is like, I want to, but I don't know, do I really want to? So Cassie connected with me, and I had a conversation with Meg, and I really got down to the nitty-gritty of what is important to you. What would make you leave your situation right now and go work for Cassie on this rocket ship up? And really the core of it, Linda, was health insurance benefits. Is I want to make sure that I get quality, comparable coverage as what I have now. So that way I'm not compromising on the one thing that matters to me most. So I spoke to Meg, and we figured out the options, and I'll portray a little bit about what those options really are and what I recommend and why. But this call is really not about the specifics. It's really just having that conversation to understand what is important and what's going to work. So after working with Meg, we figured it out, and we solved it. We solved the puzzle of what was important to Meg to make that big leap and decision to go from her corporate career to this fast rocket ship and keep her lifestyle, her remote lifestyle. So that's a PPO plan that you need to have, so your employees don't feel locked in to where they live. They can work from anywhere, and their health insurance is going to go everywhere. And now, proud to say that Meg has made the decision that, okay, I feel secure enough with my new health insurance plan that I can keep my lifestyle, keep my benefits, and work for Cassie.
I love that. What a great example of luring someone from a really safe corporate position into a new young startup and feeling secure that she could make that leap because she has the same protections through health insurance as she received in her big corporate position. So Meg, help us understand a little bit. You described what Meg's journey was like and what her decision-making was around. And for her, a lot of it had to do with being able to work remotely. So yes, being able to have a PPC plan made a lot of sense for her. But, for a business owner, for a business entrepreneur who's starting out, and maybe they have a small company, less than 100 people, maybe less than 50 people, still yet health insurance can seem so expensive, so complicated. It's difficult to decipher. And it may actually frighten off entrepreneurs, business owners, business founders from being able to offer health insurance to their employees, because while they have 10 employees or 50 employees or 100 employees now, they know that by the end of the year, they may have double the amount of employees, and that is really daunting. So what can a business owner do to begin stepping into the navigation of that really complicated arena where health insurance seems so expensive, so complicated, and difficult to decipher?
Yeah, absolutely. The first step is working with a professional, and that's where I can really step in. So I want to encourage everyone who's on this call or thinking about or in that position to please just reach out and talk to me, because there is no the best products or the best solutions in life are tailored and customized. They're not one size fits all. So I'd love to have a conversation with you to first figure out what is your primary concern and then how can I solve that, whether that's reducing premiums and bottom lines or getting better coverage for your employees so they're not all whining about their health coverage and when you're spending thousands of dollars to cover that. And then there's some really unique strategies and situations that you can employ to really drive results better. By that, I mean, we can work with plans that you just simply don't know are available. So as a business owner, you might only be accessing a public market plan, a government plan that's either subsidized or on healthcare.gov, or a shop plan, or nowadays there are PEOs where you have human resource services like ADP payroll bundled in with health benefits. But the problem there is it's not really customizable to your employee. And that's really the key difference when, working with me and also retaining top talent is, are you giving your employees a plan that they love, a plan that they understand, and a plan that they're actually going to use? The best example I can give here is a young 20s male doesn't give a crap about really good maternity coverage. And you know what? They don't have to. So if you're saying, oh, we've got the best maternity insurance plan, available to you guys, and you've got a young tech startup that's full of, early 20s, they don't care about that. So having that conversation with your employee about what is important to you for a quality health insurance plan. And guess what, guys? It's not about the company at all, nor was it ever. It's always about the benefits and does your plan pay and cover for the things you want it to cover. For example, you can have a Cigna plan that's zero deductible and amazing, or a Cigna plan that's $10,000 deductible and sucks, or a plan that covers everything head to toe, but you can only see a doctor that's 20 miles away from you and you hate it. So it's really about the policy benefits and how does it serve you? And that's really where I can step in and talk to your employees. What is it that you want? Let's build you a plan that's actually going to cover it. They're going to love you as the employer for giving them a plan they love. They're going to love me because now they know how to use their health insurance and milk those benefits for all it's worth. And it's going to save your bottom line because now you're not paying for extraneous benefits that your employees don't even care for.
That's so smart, Noor. Now I'm going to pick on Nikki here for a second because I happen to know Nikki and a little bit about her business, but Nikki employs really young people. So her whole focus is helping young people in college step into the workforce. So she's really interested in helping college students prepare for that first job. And so she employs a lot of really young, dynamic, interested, creative, resourceful workforce, right? Sometimes as an outsourced resource, sometimes as a full-time employee. So given that Nikki's workforce is really fairly young, generally right out of college, how would you begin working with Nikki to ensure that she's offering health benefits that are really relevant and valued by her employee base, but don't cost the same level of someone who may have folks that are closer to retirement?
Yes, thank you. Hi, Nikki. I think we're supposed to chat soon, so I'm excited for that. Thank you. Yeah, I look forward to that call. Great question. Thank you, Linda. And you said you hit the nail on the head there because you said price. What Nikki's people care about is how much is this going to cost me? I just started adulting and I don't want to pay any of these bills, to be very honest. So what's the bill that I can, forego? And it's most likely it's insurance because young people don't really recognize the value of it. And that's okay. And that's fine. Until you really reach your 30s and 40s or 50s, then you're like, okay, give me all the insurance that I can get. Now is when I need to do it. But when you're in that age group, and you know somewhat, okay, you know what, I need to have insurance. I understand it's important, but I don't want to pay for it. So this is where price becomes the most important factor for them to make that decision. So what can we do for a young, healthy, low risk individual to to beat on price. And that's what actually I do. My specialization is medically underwritten health insurance policies. So this is a type of a plan where instead of using your income and location as the primary determining factor for calculating your premiums, we're going to use your good health. As a young 20s person with no medical conditions, no really, major history and medications, you're a very low risk and very, very attractive to a health insurance company. They know that this early 20s individual is probably not going to have thousands of dollars in claims or need major surgery or medical care in general. So we take advantage of that. So we use that good health to underwrite on the front end and get you locked into a quality PPO health insurance plan that's going to beat on price with everything else on the market. And then that stays locked in as your career grows. So especially if you're a small business owner, having a health insurance premium that's tied to your income, that can get really slippery because as you're growing, your premiums are going up. And that's not fun. So that's something that I love to do. If you're young and healthy, let's lock you into a health-based plan so that premium stays locked in as your income and your business revenue goes up.
Oh, that's so smart. And, that's a sort of a nuance of health insurance planning that I don't think very many business owners and business founders are aware of. So I love that. Now, what are some of the options for health insurance for business owners? And how does a business owner actually make the choice to attract and to retain top talent? So how do they begin understanding what matters to their current employee base and the employees that they want to attract to their business? And then how do they begin to decipher which plan to choose that's going to be really valued and really appreciated by their employee base?
Yeah, thank you. That's a big, broad task and question. And I want to say it starts with a conversation with me. Talk to me, talk to a professional who can help you make that decision. Because as a business owner, this is a professional industry, Linda. We've got, like you said, regulations changing all the time in different states. If you've got a team that's remote and in different states, it is impossible to try to keep up with all of that and just to know and understand. So start working with a professional to first understand what's the basic demographic of my team. Are they young 20s professionals? Are they mid-career? Are they older and they're more risky? And so we do that risk analysis first, and then we decide, can we do medically underwritten plans for all to get the lowest premium? Do we have a few key employees that need a little bit more coverage than the rest? And then we craft that plan accordingly.
That's so smart. And again, I just have to reiterate that, Dr. Noor, the fact that you offer all these consultations at no charge to business owners and business founders is just remarkable to me. You have medical education and training from Bangladesh. You're an award-winning doctor. You have global experience in public health. You understand the healthcare system intimately, and yet you offer all of that consultation and all of that advice and guidance at no cost for the entrepreneurs, the business owners, the business founders that you serve, which is amazing. So when you think about some of the biggest challenges that your clients tend to face, of course, price is a consideration, but what else are they doing uniquely to try to attract and retain high caliber talent and balance price with other options?
I would say, I'm going to repeat again what I think is lacking, and the business owners that are doing this are the ones that are winning. It's ask your employees what is important to them. And a lot of times you'll find that people don't care about vision or dental. They just want this thing covered or that thing covered. So it really all starts with a conversation. And Linda, that's another one of the reasons I keep my consultations free, is because I want to foster more conversation. I want you to feel no hesitation, no objections to come reach out to me for that conversation, so we can, brainstorm and open our minds to new creative ways that we can retain top talent. And it really just starts with a conversation and asking your team, what is important to you to be covered on a health insurance plan? Let's create that plan for you.
I love that.